We have plenty of time for discussion and questions. So I'm going to ask Kasia and Peter to come up. Torben, you can stand here. You should be in the middle since we are celebrating you. That's very good. So let me ask you a question then, a very straightforward question. What do you think in this setting, or priority setting, is the most troublesome implication of utilitarianism? Because now you're just given the easy cases where it clearly kind of talks towards utilitarianism, but I mean there are some tricky cases too.
I think really the main problem is not with utilitarianism and its implications, it's to find out which these implications are. And seemingly utilitarian implications, such as your suggestions about vaccination and not only passports, but at the hospital using them to deny people access to a hospital. That sounds like a nice utilitarian idea, but that's dependent, of course, on difficult empirical questions. It could also cause a riot and disaster of all sorts. I mean, there is a tension here, how much pressure you could put on people before they start to rebel rather than to conform to sound reasoning. So I mean, it's that kind of problems, I think.
Okay, so what do you think about problems like this? Let's say we have a virus, and actually for young people it just gives, it gives a disease and you will be bad, but there will be a lot of people who's going to get this and be maybe really sick for 2 weeks. Yeah. But then in a few cases it actually will kill elderly people. But if you look at the utilitarian calculus, the small benefits of so many younger and healthy people will actually outweigh those few very old people that will die.
That could be what is about to happen now.
Yes, that's why I'm asking the question.
New mutation. We don't know, but perhaps it is much more infectious and much more innocuous when it strikes young children, younger population, but kills people like me and Peter.
Well, I was thinking about a little bit further up.
Oh, don't be polite. Don't try to be polite. You have to sacrifice at least one of us.
Okay, I'll sacrifice one of you. Okay.
Well, of course. Wouldn't we? I mean, we agree to such a policy, letting the virus loose.
So I think it does depend on the situation and whether it is possible to contain it. And I think you really, you raised the question of lockdowns, which, as you say, is a very thorny issue. But I think it needs to be considered on a country-to-country basis. Australia had very strict lockdowns because we actually had a chance of eliminating the virus. And after the very strict lockdowns, first very strict round of lockdowns, we did eliminate the virus. We therefore had no lockdowns and we had a normal life back again for several months. Unfortunately, because there were many people, many Australians, including overseas, who wanted to come back to Australia, and although we set up a compulsory 2-week quarantine in a government-supervised hotel in order to do that, somebody had to transport the possibly infectious newcomers to the quarantine, and one of those drivers got the virus, and then it got back into the community. So in the end, we're back to having the virus. But I think if you have a chance of actually eliminating the virus, even at significant cost, that was probably worth doing. But otherwise, if you don't have that chance, then maybe it isn't worth doing, and you have to accept the ways of reducing its, as you said, reducing harm rather than eliminating it. Now, the question that you raised about should you vaccinate young people, including children, even if it's not in their individual interest, because the virus is, relatively harmless in them, but it will prevent it getting into older people. So I'm prepared, maybe, as you said, like Jack Smart, I'm a hard enough-nosed utilitarian to say, I think that's a public health measure that you could require. We do, after all, or many countries do, require children to be vaccinated before they go to school, not about COVID, but about a whole host of other diseases. And I think that's a public health measure. That may be for their benefit. This one may not be, but it would certainly be for the benefit of their teachers. And after all, they do need to go to school, and you do need to have teachers, some of whom will be older. So I think you can justify that.
But that's the easy case, I think.
I think you're going over to the easy cases.
Yes. Sorry.
I once argued that we should use the vaccinations to defeat the virus. I thought it was possible for a while, and then you should give priority to taxi drivers and so. But now, I think on your assumption here, we can't solve the problem with vaccination at all, because now we have viruses that goes under the vaccination radar, so to speak. So then the idea is to let it loose. So you have two choices. You have to do some kind of perhaps lockdown or whatever. Yeah.
That will, it is. You will have this if you go that they will. A lot of young people, they will get it, but you just get a little bit of it. But it will kill some older people. But if you look at the kind of utilitarian idea of it, that would be the justified action, because the small benefits for all these young people would add up to more.
And remember, it's a statistical matter. Not both of us are killed, just one of us.
I could think of utilitarian reasons to save you both. But if we look at the matter a bit broader, I mean, we do need parents and grandparents, right? I mean, we are society as a whole. I have young children. You may have young children that need still grandparents. So I really think it's easier, especially on the level that we have now, yes, if we use a bit of solidarity rather than thinking only about individual lives, yes.
Good. I'm going to open up now for questions both from the audience here and for the audience online. So please just put up your hand if you have a question. Now I see there's one question there. And you should get a microphone there, exactly. And please present yourself and tell us who you are, and then ask the question.
My name is this on?
It doesn't seem to be on. Try it again, it might be over there.
Hi, my name's Sarah Hicks. I'm a student at Linköping University in Applied Ethics. My question is directed towards Dr. Tanjo, and I'm sorry if I butchered your name. But in your introduction, you mentioned hypothetically this question of like, where do we draw the line between coercive and non-coercive medical care? And I'm curious if you could speak a bit more towards like where you think that line is, because as Dr. Singer quoted from the New York Times, the woman who said, like, not getting vaccinated is not a personal choice. And there are a lot of people, especially in the US, who object to the vaccination because of perhaps religious reasons. So at what point could you say that public health supersedes your personal, like, let's say, religious convictions?
I would say that in principle, and I wouldn't object even to Peter's and Katja's idea here that we even put them lower on priority in hospitals if they are not vaccinated, the patients. But again, I think it's an empirical question, what is working here, and a delicate one, I think, a difficult pedagogical task really to reach out to those people who, for some reasons, do not want to be vaccinated. I mean, some of them are low-hanging fruits. I mean, you could easily get them vaccinated if you just send them that go to this place at this time, and so then they will go, I think. But quite a few are reluctant for all sorts of reasons, and then it's difficult. I mean, we see this. I mean, we have small demonstrations in Sweden, but by these anti-vaxxers, and so it's important not to get that kind of sentiments onto the streets. So I don't have any principled objection here to be quite rough in public health measures, but they must be effective.
But it doesn't that also depend on the case? I mean, if there's only like some percentage of people who are anti-vaxxer, it might matter. It will not matter that much from the perspective of herd immunity. But if you have 30%, what would you do then?
Yeah,
And that's really the only way to stop it.
Yeah,
As a libertarian, what are you
again,
gonna do?
I have no principled objections to doing it, but it needs to be effective. It could easily misfire, I think, and be counterproductive, really, to be too harsh, rather than try. I mean, that has also been part of the Swedish lenient strategy to try to convince people, to argue with people, to treat our population as reasonable people. Some are probably not that reasonable, but then how do we target them in the most effective manner?
So if you look at the policy in Austria, what do you think about that? Is that justified?
Also, I think it depends on context. I mean, I know too little about Austria to really say about the effects there. But I doubt that it would work in Sweden. If you took your idea there seriously to start refusing accepting patients in hospitals, because it's also a complicated empirical question. We don't know exactly what protection you get from these vaccines, and then some people refuse the vaccination because they have had already the disease, and they claim that they are not vulnerable to the disease. I mean, they are wrong probably, but it's also a complicated empirical question. How?
So you don't believe in Peter and Kasha's proposal that there should be, if you're not vaccinated, you're not going to be prioritized in the healthcare system?
If I wasn't could decide the matter here in Sweden, I would vote against your proposal on that.
So what
Because
do
you think it wouldn't work?
Yes,
or
yes,
something. I
yes.
see.
Yeah.
Right.
But what do you think? I mean, we do have a somewhat similar system. Comes other thing, for example, if you crash your car, you're going to pay some money. You don't get everything replaced by an insurance company. And if you crash your car because you've been drinking, I mean, you're going to have to pay everything.
Yeah.
But you're not opposed to that kind of regulations.
No, I'm not.
So what's the difference between that and having some penalty if you haven't been vaccinated?
Because, I mean, it opens up so many different questions also to answer when you argue from case to case. You have the smokers, for example, today, and you could add all sorts of complications to this. So I think it would be nice if we could avoid it. Here I side with the Swedish Parliament and their decision. I don't think that we should make distinctions such as these.
Yeah, so I would say that we are pretty irrational. 40% of Poles, 46% of Poles have not been yet vaccinated, while 500 people daily die from COVID at the moment in Poland. And they made a poll, and it turns out that if you pay people 50 zlotys, which is the price of 2 cinema tickets, 20% of those people would want to go and get vaccination. And come on, right? For 50 zlotys, yes, for 2 cinema tickets, they would be eager. That means simply that their reasons for not getting vaccinated are really silly, probably, yes. And if so, I agree that we should find the best ways and to
give them the tickets.
Give them the tickets, give them the money for whatever they want to buy. Of course, our government doesn't want to do that. That's another matter. That's a political matter, yes, because it's a right-wing government which wants to protect people who are against vaccination. So there are all kinds of reasons that lead to real deaths. And I think that we should limit it sometimes even by force.
And Kasha, I think that's a great point, and I'm surprised that those kind of policies are not discussed more, because we also know that when it comes to voting, making it obligatory and having some silly fine of 15 euro will make over 90% coming out voting. So there are still a lot of things in the arsenal. But as far as I know, I don't know any country that have actually offered an economic incentive to get vaccinated. Do you know about this being used?
Some states of the United States have done so. Not at a national level, but individual states have chosen. And they've actually offered, I think, $100, so more than a couple of cinema tickets. And that has significantly increased the people getting vaccinated, but it doesn't mean that they're all getting vaccinated.
So we had lotteries. Yes, so if you were vaccinated, you would put your number into a special place, and there were lotteries in which you might get bicycles or even some money. But it didn't increase vaccination rates much. I mean, we don't believe in lotteries, right? So.
That's rational.
Whereas it's a lottery, not getting vaccinated is a lottery with COVID, right?
Yeah.
But you always think that you want one and you won't get the virus.
We have a question from the audience here. Ole Norheim, you're going to get a microphone. Is there any questions coming in on the... Okay, so we'll take that next. Okay, very good. Ole.
Thank you. I'm Ole Norheim from University of Bergen, Norway. Thank you for excellent talks. I have a challenge for you. Gustav asked you about dilemmas that will challenge hard-nosed utilitarians. So going back to the ICU unit, if you have two patients similar in all respects except same age, let's say 80, one have had moderate disability for all his life, the other has not. So the other is more healthy, so probably would gain a few more QALYs than the other one. Would you give priority to the last ICU bed to the one without the disability?
That's a very good question. Let me add,
Which
you
of
were
the
talking about
QALYs?
quality.
Could we
Just a
perhaps
second. You were talking about QALYs. We should explain that in your answer what a quality adjusted life here is.
Yeah, okay. But that's a very long answer then, because it's not well defined, this notion. But you could say that it's a matter of life quality and lifespan measured together. But then, I mean, utilitarian is not quite satisfied also with how it's defined, this notion. So, and also I'm a bit troubled by the way you phrase the question with reference to disability. I mean, disability should never, I think, be a reason for denying anyone services and so. We can't argue that because of disability there is lower quality of life. But if there is lower quality of life because of some medical condition, pain, for example, or the problem with disability is our capacity to adjust, to adapt, I think, to various sorts of disabilities. But there are things we can't adapt to, such as depression, such as pain. So if there is more depression or more pain in one of the patients, I wouldn't hesitate to give priority to the healthier patient.
So here we have this person that have had 80 years of a very happy, good life, and this other person haven't had that, but could have it. And you give priority to the person who already had a great life. What is the fairness of that? That seems very unfair.
They were the same age, you said. But
the idea is that, one had... You could, if you want to make the case, have had some kind of affliction that have made their life in the past not as good as the other person.
Okay.
So there's an equality issue here.
Yes, I see. Okay.
You're trying to avoid the hard question and make it easier.
Yes, and then it's a hard question. and then it's, if I'm correctly informed by my colleagues, the Norwegian idea about needs count in the favor of the person who has had this bad life, rather than the now. The person who has had a happy life,
like you,
like me, but with a better prospect also. Yeah, I agree that this is an interesting philosophical objection to utilitarianism, but I don't know any way of convincing the audience in a few words like this. I just announced that I would go for the patient with a better prospect, and I would disregard the past.
But you see some grip in the idea of equality. You're not completely anti-egalitarian.
I see some. I mean, when you meet objections and arguments, and you sometimes find that some of them are better than others, and the egalitarian ones are better than this reference to human dignity. And even better, I would say, are the prioritarian ideas about the value of the diminishing marginal utility of utility, so to speak. The happier you are, the less an addition of happiness weighs, or the more in pain you are, the more moral value if you release only some of the pain. So that's my most difficult objection, I think, to utilitarianism. It took me a long time to defeat it.
So Kasia and Peter, do you want to comment on this case? There's a
I
conflict
agree.
between-
We are actually three hedonists, like three musketeers, I thought. So we must be brave.
And I'm Richelieu here. Okay, very good. We have a question from online.
Yeah, we have two questions. I'll start with one for Peter Singer. It's a follow-up on your proposal to treat vaccinated and unvaccinated people in ICU differently. Would you put the same announcement on smokers or drinkers? If you do not quit smoking or drinking in a month, you will be downgraded in priority to ICU compared to non-smokers and non-drinkers?
Well, smoking and drinking don't tend to cause this pandemic that overwhelms the ICU because they're part of the background condition which has been going on for a long time. So, I mean, I was specifically suggesting this in the emergency situation that the emergency room physician describes. So no, I wouldn't. But it did occur to me when we were talking about refusing people because of their behaviour that there is in fact a parallel relating to drinking, and that is with liver transplants, because people who drink heavily destroy their liver. So I think there is a case for saying, again, that if you have two different patients, one of whom has suffered an accident and that's destroyed their liver, and another who has been drinking and let's assume has been warned by their doctor several times over the years that if they don't stop drinking they will destroy their liver, but they continue to drink. I think in those circumstances I would give priority for the liver allocation to go to the person whose behaviour was not a choice, that they had been told would lead to this outcome.
Why would you do that? Because retribution, or
no, it's not retribution. It's rather, I suppose, to encourage people to heed their doctor's warnings, that they can't rely on the healthcare system to pull them out of it if they continue.
If I may add something, yes. So the problem with smoking and drinking is usually that it's an addiction, yes, which may be very hard to overcome. So there is a philosophical question with free will and whether we may give those people the way to overcome this addiction that is behind their will, but for example use some medications and so on. So I think it's a bit different case because of that. It's much harder for people to stop smoking and drinking.
Very good. We had a second question?
Yes, I have a second question. It's a long one, so I'm going to read it out, and it's addressed to Torbjörn, but maybe you could all answer it, all three of you. The question is, in Sweden we used to have forced sterilization of those considered to have low social utility, whose children in turn were, it was feared, going to be a burden on the economy and on the majority, especially in the 1940s and continuing well into the 60s. For example, women considered to have loose morals, deviants, people with low intelligence but no mental impairment, etc., were also sterilized. How should we view this from your utilitarian perspective? Do you see any risk that if public officials get the power to decide on whose life is socially useful and not, then they will use bigoted standards and you abuse this power in a way that we will find morally deeply problematic in a few years, like most people now think it was the case with those sterilizations?
Okay, the sterilization policy was based on bad science, of course, and that makes it easier in a way to discuss it now. We could just say that they were wrong, they shouldn't have done this. That's one comment you could make on this. It's also a matter of coercion here, which is interesting. I mean, when we discuss whether people should be coerced to receive the vaccine, I think no one has argued that physically we should put the jab in their arms and holding them back. So, but we didn't do that with sterilization either. People were kind of subsidized to go through it or threatened with sanctions if they didn't do it. So in a way it was voluntary. And it was wrong. So that's the easy way of answering it. Bad science, And for the same reasons, I argue that you shouldn't try to assess the social importance of people when you admit them to the ICU unit, because there's no way of doing this. I would say, for example, that people in advertising are harmful to society, while others would say that they are important to society. And so we couldn't really make out that kind of assessments. But the interesting thing to think about with sterilization is, had there been a real threat to society if we hadn't eliminated certain characteristics in the gene pool? And so, I mean, we now know that they were wrong also about genetics in those days. But what if they had been right? What if it had been pertinent really to the saving of civil society or so, to not to have certain genes spread in the gene pool in the population? Would we then have welcomed that kind of measures? I think if you want to put it in historical perspective, what they did, then we should put ourselves in the shoes of also those empirical beliefs these people held and so on. And then it's a much more difficult question, I think. There is a point, I think, where we would be prepared to use also sterilization against real threats, if there were that kind of threats. Now, there were no such threats, so it's easy to just look back on our predecessors and say that how wrong they were. They were empirically speaking wrong, but were they also morally speaking wrong? I mean, we don't know that until we have confronted the facts of the matter.
Peter?
Yeah, I think I agree with Torbjörn, and if you want a scientific example, there is a case of a very rare gene which was traced in a Dutch family some years ago, in which the males engaged in violent assaults and crimes, somewhat inexplicably. This was not true of the females, but it was traced to a particular rare genetic abnormality. And I think you could well argue that in that family, given that they knew that the gene was in the family, sterilization mightn't have been necessary. It might have been they could have just used IVF to select only female embryos that would result in females. That might have been an alternative there, but I think that would have been justified given the high likelihood that males would commit violent crimes.
Kasia?
Yeah, so I would add that for just this reason that we are talking now about, utilitarians are also delicate in presenting certain outcomes or proposals, yes, because we worry that they may come out badly. So in general, utilitarians are similar to everyone else, and they just support common sense. Only sometimes we differ.
Very good. We have a question in the back there. I think it's Hans Fingerroth, but I can't see. It is Hans Fingerroth. Very welcome.
Thank you so much for your very interesting contributions, all of you. And Hans Fingerroth, Stockholm University. I have mainly a question to Torbjörn here about the concept of human dignity. And of course, at that level of generality or a so-called ethical master concept like human dignity, it's difficult to draw out the concrete implications of it in different contexts. So I agree with that. But on the other hand, it's not a fussy, sloppy concept. It's often very fruitful to delineate it and understand it through negative contrast. So when you're not showing respect for human dignity, you exploit someone, you demean that person, you make that person an instrument, etc. So I think this is the terrain, ethical terrain of the concept of dignity, to be a contrast to these kind of situations.
Yeah, so maybe you're given a bit short shrift here of dignity, so now
Yeah, okay.
can you defend yourself?
Okay. Well,
With dignity.
first of all, it's sometimes incorrectly translated, I think, in Swedish and other languages as value, and then it starts to spread all sorts of misunderstanding. So dignity is something different, and it has certain, I think, clear normative implications. So it's not that it's unclear in that way. I wouldn't say that it's a fuzzy, unclear notion, but it has different implications in different contexts, as to say. You have the Kantian idea that you should never use anyone merely as a means to whatever good ends. Then the dignity resides not in being human, but in being rational. So I mean, that's what you have to qualify on the Kantian approach. Then you have the sanctity of life doctrine, where it's associated with being a human being, and you have this protection against intentional killing, at least unless you're a murderer or so, or should be executed. So it fills all sorts of roles, but in all those cases, I think you could easily skip it. You could keep the normative content without using this term. And then you could say, well, it's strictly forbidden to use someone merely as a means, person in Kant's way. You need not add that persons have dignity, and that's why we're not allowed to. Then I think it makes poor sense. That it doesn't add really any strength to the normative argument. You have a clear principle here. You could try it out in the implications of it and try to take up a stance to it. But
so you think you can eliminate?
You could eliminate, I think.
So let me ask you about the case. Think about this. There is some kind of competition how to throw a person of very short stature, of extreme short stature. And it will give a lot of pleasure to the audience. They're going to laugh. So if you look at the utilitarian calculus, that will be the right thing to do. But it seems sense to say that that is not treating a person of very short stature with dignity. Can you eliminate now the dignity concept here?
Yeah, I think I can eliminate it easily in this case, because the idea is that one should not treat whatever it is, person, a human being, or whatever you're really interested in here, in the normative theory. You shouldn't treat them like that. You can have that idea without.
But why? What is the reason? It can't be the utilitarian reason, because you said it would make people happy.
Certainly. I mean,
so
this is a basic.
What's the reason?
This is a basic normative.
Yeah, but what is the basic concept you're using there? It's not happiness. It's not maximum. So what? You're going to replace dignity with something?
Yeah, you have to. I mean, it could be this using someone merely as a means, for example. That could be that Kantian idea. So I think it's more clear if you could really drag out not those loose normative implications, but spell them out, the normative theory that you're relying on here, and don't use this word.
Can I just add? I mean, utilitarians don't want to use anybody, and that would say really any sentient being, merely as a means, right? Because to use them merely as a means suggests that their interests, their well-being, their happiness isn't taken into consideration. And I think that's the problem. You may, and utilitarians may sometimes take the interests of the person or animal into consideration and say, nevertheless, we must use this person as a means, because if we don't, the cost to others will be much greater. Derek Parfit has this example where you're trapped in a crumbling building which is slowly collapsing, and concrete block is going to fall on your daughter and kill her, unless the only way you can stop it is by moving the leg of an unconscious stranger so that it stops the block falling, which will crush the unconscious stranger's toe. So you're using the stranger as a means, but it's not that you don't take the stranger's interest in having a crushed toe into account at all. You just say it's overridden by the alternative, which is the loss of my daughter's life. So you're justified. Now, a strict Kantian, I suppose, might say you're not justified because you're still using the person as a means. I don't know. I'm not going to interpret
But no
Kant.
need for either for you or the Kantian really to have recourse to this dignity notion.
No, we don't have to.
You could say whatever you want to say without using it.
Times is up to end this session with dignity. I think you all join me and thank all the three speakers for this lovely morning session. We're coming back at 11:15. We're going to have a coffee break, but join me and thank you.
Thank you very much. Thank you.
Thank you.
Thank you.